we discussed exactly, we presented the data of the PALLAS study, relationship between clinician grading symptoms based on the common toxicity criteria, and patients reported quality of life. The quality of life was assessed using the EOTC C30. And all patients with valid CTC reporting and quality of life data from both study arms were analyzed in the time of approximately 3, 6, and 12 months. In the PALLAS study is exactly randomized study comparing the addition of the 2 years palbociclib to adjuvant endocrine therapy versus endocrine therapy alone in patients with hormone receptor positive human epidermal growth factor negative breast cancer. And direct comparison was made between symptoms of nausea, vomiting, constipation, pain, dyspnea, diarrhea, and insomnia with those of CTC, because they are the same symptoms in the quality of life questionnaire and in the CTC adverse events. And we can see that neutropenia, leukopenia, fatigue, arthralgia, and upper respiratory tract infection were the most frequent toxicity reported by the physicians. On the other side, fatigue, pain, and insomnia were symptoms most reported by patients. We have more than 4,000 patients, or nearly 4,000 patients, and 12 months after the 12 months after the start of the therapy, and the correlation between toxicity and various quality of life and functional scales was very low, less than 0.10. Weak correlation, this means less than 0.30, were found between symptom scales and CTC ratings. Except for the nausea, we found weak to moderate correlation for the nausea. The highest agreement was found for nausea, pain, and diarrhea, and no agreement exactly between clinicians and patients was observed on the dyspnea and insomnia. This means, in conclusion, we can say the patient's treatments experience and side effects are only partially and insufficiently captured by the traditional clinician-graded symptomatic of adverse events, and this disparity between clinician gradings and patients' reported symptoms suggests that the inclusion of the patient's reported outcome is very important. It is necessary to assess exactly the real treatment-related symptoms during adjuvant breast cancer therapy.